Well, good morning, everybody, or wherever you are in the world as you're watching. Good afternoon, good evening. My name's Tabitha Orth, and I'm the Executive Director of International Autoimmune Encephalitis Society. And today, I'm really happy to introduce you to Bruna de Fuentes Diaz. Um, Bruna, I'm so glad you could join us today for Ask the Doctor, our first episode.
Yes, I'm very happy to be here. Thank you so much for inviting me. Yeah, I'm very happy to help with the questions, general questions, right?
Yeah, that's right. Um, I have wanted to have a show and an opportunity where people could ask direct questions. And as we start off our first show, um, why don't you tell our viewers where you're located and what you do?
Yeah, absolutely. So I'm Bruna. I was born and raised in Brazil. I did my medical school in São Paulo at Albert Einstein Hospital. I graduated in 2021, and since then I moved to some here in California at Stanford. I'm a research fellow under Dr. Emmanuel Mignot. He's gonna be talking to you guys in 28th, I think, this month, right?
Yeah,
So check
Rare
it out.
Disease Day, February 28th. Yes.
Yeah, so please check it out. He will be updating on our projects here on autoimmune encephalitis. And I've been studying, like, I've been in this research world on autoimmune encephalitis since 2018, since I was in medical school. And yeah, I love doing that. And yeah, I'm very happy to share some of my knowledge, and mostly in research area and most recent um, yeah, topics in on autoimmune encephalitis.
Well, we really appreciate your time. And for those who are watching, the email will also be in the description box of this video, but people can write in to ask the doc, DOC, at autoimmune-encephalitis.org. And as we gather questions and can get together, to do these episodes, we'll be tackling them one at a time. Okay, so let's see what the first question that was sent in is, how do you explain the diagnosis of autoimmune encephalitis to your patients?
Yeah, well, this is a good question. I know autoimmune encephalitis is a big word, but if you can separate them down, you can we can easily explain it. So I usually say that encephalitis means inflammation of the brain, and autoimmune means that the patient's body produces antibodies, which is molecules that we all produces, for instance, against infections, virus, bacteria, fungi. Um, and then these antibodies attacks brain cells, and this produces the inflammation of the brain and gives all your the symptoms. Um, and the big question in this autoimmune encephalitis diseases is why and what triggers it, right? Why the patient's bodies produce antibodies against your own cells. And this is what we're working on, like researchers all around the world, and trying to understand better how this process work. Um, because it's unclear yet. Specifically NMDA encephalitis, it's a little bit unclear how it happens and why it happens. And then the question if it will happen again, it's also tricky because of the same reason, because we don't know what triggers in the first place. It's hard to tell if it will recur or if it will happen again. And if for those who doesn't know, autoimmune encephalitis was first discovered in 2007, specifically with Dr. Dalmal in Spain, and he described a group of women with anti-NMDA encephalitis. And since then, we're all researching and trying to understand how it works, these mechanisms on autoimmune encephalitis. So it's a new disease that raise awareness is very important to diagnose and treat fast, because it definitely improves prognosis of the patients and quality of life. And that's why it's very important.
You know, patients will, and several people who have written in, um, they will ask questions about, will this specific treatment be good for my person, my loved one, or that specific treatment, or because they want to get a feel for what what treatment, what is the magic treatment that worked for other patients, because that's the treatment that um, I want my loved one to have. And I wish that there was a magic treatment, but autoimmune encephalitis, like you were just saying, it's a group of diseases, isn't it?
Yeah, I like to explain it. It's like a umbrella where autoimmune encephalitis is a big umbrella. And there's a lot of subtypes of autoimmune encephalitis. For instance, anti-NMDA encephalitis, LGI1, AGLON5, GAD65. All of those, they're specific subtypes of autoimmune encephalitis with specific guidelines for treatment, and we're still studying and improving the best approach for each one of them. So it's very important to each case has your own neurologist and doctor to even for talk about if you have the indication or not to receive this specific treatment. So this will depends on each case and individual conditions. Yep.
I think that is so important for people to understand, because when you're coming into the community and you are just receiving a diagnosis and you honestly have never heard what autoimmune encephalitis is, you're hearing that for the very first time, and you want to know, well, what treatments worked for you? There isn't an answer to that question. As you said, each case is highly individualized, and doctors are constantly monitoring after a treatment to see how that patient is doing. What works for one patient may not work for another patient, and it's a combination of treatments. And just as this first episode, to help people understand how this is a group of diseases, just like cancer is a group of diseases. It would be like asking a cancer patient, what treatment worked for you? There are so many different kinds and so many variables. I wish we could answer the question, you
Yeah.
know?
Yeah. I mean, there's some of those specific types of encephalitis they have more studies on. For instance, NMDA is one of them, is the most common cause of autoimmune encephalitis in the world. So in this umbrella, the first one would be anti-NMDA encephalitis. And there's, for this disease specifically, there is a more standardized approach for treatment where we can kind of try it on depending on the patient's condition and symptoms and progression, which is right individualized to each case. But we have some things to consider. The first one is that if you treat and diagnose fast, it will definitely improve quality of life and prognosis. So this is in all autoimmune encephalitis. the faster you can diagnose and treat, the better for for prognosis and better outcome after the disease. So that's why this is very important.
And we're seeing that happen more now. Uh, 10 years ago, a patient may have taken a year or 2 years to receive a diagnosis because it is a new group of diseases and it was so rare. And then about 5 years ago, we started seeing about a 6 months from onset with LGI1, for example. Um, and now regularly we're hearing that a person goes into the hospital, they get the full workup. More and more doctors, especially at university hospitals, um, uh, uh, it's being recognized and they're getting a diagnosis and beginning treatment right there. And research is happening so quickly in this field. We are so looking forward to Dr. Mignon's presentation on the 28th as he's talking about what they've discovered about genetic links. That is so incredibly exciting. So we did have a few other questions that were just case-specific questions, and each person apologized for their case-specific question. And so we want to acknowledge Liz, Candy, and Jason. Bless your heart. We send you the very best out there. But we can only do general questions, and so give it another try and write in to ask the doctor without details about a case, just a general question. Bruna, I want to thank you so much for joining us on this first episode. And as questions come in, we'll do another episode of Ask the Doctor.
Yes, absolutely. Thank you so much. It was very nice to be here. Thank you for all the questions. I hope I can meet you all next time. Looking forward to
Okay,
it.
see you next time. Bye,
See you.
everyone.
Bye.